know that the drugs can be taken by the different routes for a given condition. Now, before going to the classification of different routes, their advantages and their disadvantages, first let us discuss about which route will you select for the drug administration. Now, to start this, I would like to discuss different clinical scenarios. First is an adult male having headache after attending pharmacology lecture and you want to prescribe paracetamol. Then a 2 years old child having high grade fever and you want to administer paracetamol. Then an infant having an acute episode of bronchial asthma and you want to relieve the asthma while salbutamol. Then a terminally ill elderly patient having carcinoma and require a long-term administration of opioid. Then an adult male developed an acute attack of bronchial asthma and you want to relieve it by salbutamol. Then a sports person developed ankle sprain and you want to administer Diclofenac. Then you want to administer the fluids in an unconscious patient. You want to give Furosemide in a case of acute pulmonary edema. Now we discuss these one by one. First and foremost, an adult male. Today you all have attended a pharmacology lecture and suppose you develop a headache and you want to take a paracetamol. Which route should be selected? Okay, for that the factors that you should discuss is it an emergency condition? No. Are you conscious? Definitely yes. Whether the paracetamol is absorbed orally? Yes. If it takes some time to relieve the headache, is it okay? Then fine. Then which is the most feasible way? Then the answer is oral route. So in this condition the answer should be oral tablet of paracetamol. Then a 2 years old child having high grade fever. Okay. Now you have decided to administer the paracetamol and suppose the temperature is say for example 101 degree Fahrenheit and one has decided to give the drug by the oral route, but you know that child is not able to take the tablet. So the dosage form should be, or the route of the administration should be liquid oral dosage form in the form of a syrup. Then a 1 year old child developed acute attack of bronchial asthma and you want to administer salbutamol. Salbutamol is a bronchodilator. Okay. So ideally the drug should be given in such a way that it reaches to the target site and that is respiratory tract. And you all know that through inhalation it is possible. But child is not able to do the actual inhalation practice which is required by the routinely used metered dose inhaler. And that's why passive administration of the drug into the respiratory passage is required with the help of nebulizer. Now if the same thing develops to the adult male and you require the salbutamol, but here you will use metered dose inhaler because patient can do the actual respiratory effort. Then administration of the diazepam in status epilepticus. Now we all know that diazepam is an benzodiazepine and it is a drug of choice for status epilepticus. Your aim in the status epilepticus is to immediately control the seizures Okay, and that's why immediate plasma concentration of the drug is required, and that's why the preferred route is intravenous route. Then administration of the fluids in an unconscious patient. Your aim is to administer the fluid. There may be any reason, but you want to administer the fluid because of dehydration or any other reason. But here you have to administer a large volume of the drug, and that's why if the patient is unconscious, so you have to go by the intravenous route. That is fine. But again, you have to continuously administer the drug through the intravenous line because you want to administer the large volume of the drug, and that's why intravenous infusion is the requirement in the given case. Then a drug furosemide. It is a high ceiling diuretics. Presently you don't know much about either furosemide or acute pulmonary edema, but here I just want to emphasize that acute pulmonary edema, it is an emergency condition, and there are certain conditions, even emergency conditions, in which the large volume of the drug is given rapidly IV, that is known as a IV bolus. Okay, so furosemide will serves its purpose, and that is shifting of the fluid from the pulmonary to the systemic circulation. So, dear friends, don't bother because presently you don't know about the furosemide and you don't know about the acute pulmonary edema, but you just remember that there is a certain acute emergency condition in which large amount of the drug is administered IV rapidly, that is known as a IV bolus, when there is a requirement of sudden high plasma concentration. So if you just look at the carefully, even through the intravenous route, we are having three possibilities. One is the bolus, second is the infusion, and third is the injection. Depend on the need of the patient and the clinical condition. Then just today's class we have discussed about the penicillin. Penicillin is a very safe antimicrobial. The only problem is it's in some patients they are allergic to the penicillin, and in that there is chance of development of anaphylactic shock. Now for that you have to do the scratch test, and for that you have to administer the small amount of the penicillin by the through the intradermal route. So if local reaction develop, then this shows that the person is allergic to the penicillin, and that's why one should avoid penicillin in such case. So for that scratch test, small amount of the penicillin is given through the intradermal route because we want to see the dermatological reaction is developed or not. Then you all know about the administration of the vaccine against COVID-19. It is through the intramuscular route. Then yes, suppose the patient is having type 2 diabetes and it is not controlled with the oral anti-diabetic drugs, and you want to administer the insulin. Now we all know that insulin is a peptide. You cannot give it orally because orally it is immediately degraded. So it is given by the parenteral route. Okay, and patient has to take it for lifelong, and that's why the easiest way for the patient is through the subcutaneous route, and that's why insulin is given by the subcutaneous route normally in the type 2 diabetic. But in the diabetic emergency condition, insulin is given initially by the intravenous route. Then an elderly patient having carcinoma, terminally ill, the condition is serious and you require an analgesic for the palliative care for a long time. So your aim is just to give relief to the patient. Patient is already in the pain, geriatric patient. Okay, so in that case, even if you give the drugs through the injection route, again the pain will be more, the patient is discomfortable, and that's why if you administer the drug through the rectal route, that is called the rectal suppository, that is the ideal option in the given case because rectum is having a very rich blood and nerve supply. Okay. Then a sports person, you have seen during the sports developed ankle sprain or other sprain very frequently. In that case, you want to apply an analgesic with irritant and counter irritant effects, and that's why the immediate relief is through the local spray. Okay, so here the Diclofenac, it is a non-steroidal anti-inflammatory drug. It is applied through the local spray. Then administration of an antifungal drug. Miconazole is an antifungal drug and the patient is having vaginal candidiasis, vaginal fungal infection. So insertion of the vaginal tablet of miconazole, and that route of administration is known as a pastry. So from the previous example of ankle sprain or this miconazole in case of vaginal candidiasis, it is very clear that if the site is accessible, then the local administration of the drug is a better option. So again, just quickly revise this. In an adult male having headache after attending the lecture, oral tablet. 2-year-old child having fever, a syrup. 1-year child having acute episode of bronchial asthma, nebulizer. Adult male developed acute attack of bronchial asthma with metered dose inhaler. 3-year-old child developed febrile convulsion, diazepam, that is suppository. Same way the suppository is in the case of a terminally ill patients require analgesic. Ankle sprain during sports injury, you want to administer Diclofenac through the spray. Administration of the fluids in the unconscious patient, IV infusion. Furosemide in the acute pulmonary edema, IV bolus. Test for the penicillin allergy, intradermal administration. Administration of COVID-19 vaccine through the intramuscular route. Insulin administration in type 2 diabetes through the subcutaneous route. Administration of diazepam in status epilepticus, intravenous injection. And administration of the miconazole for vaginal candidiasis in a pastry. So in short, if we want to summarize the factors which decide the routes of the drug administration, that are certain drug related factors, certain factor related to the condition of the patient, certain factors related to the disease itself, the severity of the disease. Okay, so first and foremost is the site of the desired action. As I told you that if the desired action is required at a site which is accessible, in that case, and it is not an emergency condition, then the local route is definitely better, as we have seen in the case of the ankle sprain or we have seen in the case of the vaginal candidiasis. Then the condition of the patient. If the condition of the patient, if it is not that much serious, you can think about the oral route if the condition, if the characteristic of the drugs permit. Now why I am using this term? Because there are certain drugs which are immediately degraded inside the GI tract. Say for example the insulin. You cannot give insulin orally. Okay. And if the condition is serious, then you have to go for the intravenous route. Then the next is, yes, it is very important, the rapidity with which the action is desired. Say for in the case of the acute pulmonary edema, you require a very high concentration of the furosemide. That's why you have to give intravenous and again in intravenous through the intravenous bolus. Okay. But when in case of the headache, it is not an emergency, so you can give the drug by the oral route. But again, if the patient is having a GI tract upset like the repeated vomiting, then you cannot give the analgesic by the oral route because the drug cannot be retained inside the GI tract, and that's why again you have to go for parenteral route. So there are multiple factors that will decide the route of the drug administration. Accuracy of the dose required. Okay, suppose in case of the headache, it doesn't make a difference if the out of the 500 milligram in one case the 300 milligram reaches the target site, in another case 350 milligram. But in case of the dopamine, when you use the dopamine in a cardiogenic shock, you require a fixed plasma concentration. Say for example, the 5 microgram per kg per minute administration is required. The reason is that you require a fixed plasma concentration over a prolonged period of time. In that case, the drug has to be administered by intravenous infusion. This is one of the major indication for the administration of the drug through the intravenous infusion. Then properties of the drugs. I have told you that there are certain drugs which are proteins or peptides in nature. Say for example, the insulin. If you administer it orally, it is immediately degraded. There are certain drugs which are not absorbed at all through the GI tract, like the quaternary ammonium compounds, aminoglycosides. Even though they are not degraded, but they are not absorbed at all. There are certain drugs which are highly irritant to the GI tract. You cannot administer through the oral route. So the properties of the drugs are equally important. And last but not least, even if the drug is not degraded or the drug is absorbed, but its rate and the extent of the absorption. Suppose the drug is very well absorbed, but before reaches to the target site, it is degraded somewhere else. Say for example in the liver, that we will discuss in the pharmacokinetics, that is known as a high first pass metabolism. In that case, again you have to think of a parenteral route. So there are multiple factors that will govern the route of drug administration. Again I am repeating: the site of the desired action, the condition of the patient is conscious, unconscious, serious, not serious, patient is cooperative, uncooperative, age of the patient, rapidity with which the action required, the accuracy of the dose required, characteristics of the drugs, and the rate and the extent of the absorption. All this will decide the routes of the drug administration, and the different routes we will discuss in tomorrow's class. But it's my sincere request that you go through this point before attending tomorrow's class. Thank you very much.